Everybody. This is treatment planning for OnCentra using the Contura balloon, and we will be doing two separate cases here. We will do a simple case first that I have shown already, and when we finish this we'll make a separate presentation of a more challenging case. The first case is pretty much a plain vanilla case, and so it will be very simple, and we'll use that as an illustration about how you create all the structures and all that kind of stuff, and how you do the optimization in a simple way. Excuse me. In more advanced presentation, we'll go in a little bit more depth about optimization and evaluation. Now, a note before we start: the structures that we define here and the exact way that we define them, of course, is a matter of clinical judgment. And so every radiation oncologist is likely to have a little bit different style in terms of how they like to have those defined. And so you should understand that what we're illustrating here is primarily the process. Your structures may look a little bit different depending on the individual case and the preferences of the radiation oncologist. So we're going to start by creating some structures. In OnCentra, we do that with the little new ROI button here, and generally we create them on the fly. Typically also, when you start a new ROI, you get this dialog box, and you can type in first the ROI catalog type. And I'll show you what my list looks like here. I've created not only the ones that come with OnCentra, but I've created some special ones for APVI. One called Applicator, one called RIBS, one called SkinMax. If you do that, then when you create these ROIs on the fly, it's much faster. And when you create one for the first time, you have to select the type. And I'm going to select the external here, but I'm going to do that by typing an E on the keyboard, and that jumps me directly to the external, which is what I want to do first. And it'll give us a default name, and in this case it's external. That'll be just fine. So we'll go ahead and we'll begin with the external. Pretty easy. Now in OnCentra, the easy way to do that is to use the automatic contouring up here in the toolbar. And what you will see is that in your main view, it will give you a thresholded view, and you will change the threshold levels until you see everything you want inside will be colored white. And you can scroll up and down. Oh, hang on. You can scroll up and down through the images and make sure that it doesn't break anywhere. I think I want that just a little lower so it's a little brighter. And you got to be careful if you select something like this and then roll the scroll wheel, it'll move that thing instead of moving your images. But this looks pretty good for me, so I'm going to go ahead and do that. The other thing that we probably want to do is instead of doing the whole image, we'll use a rectangle instead. So we'll hit this button right here, and that gives us a rectangle that we can change. And the primary reason for this is for excluding the table, and we want to move that out to make sure that we have the entirety of the patient included here, like that. I'm going to scroll up and down and make sure that the patient stays in there. That looks good. So we'll go ahead and create the contour. You will see in this 3D view down here the contour once it's created. And I'm going to turn this on to make sure I can rotate it to begin with. One of the things that we want to be able to do, hang on, let me rotate here, is in many cases where the catheter comes out of the body, you can see some voids, and I just want to have an idea that we're doing that correctly. You can also check on the main view, scroll through, and see if it looks a little funny in places, which it does, and we're going to do just a little bit of editing to fix that. So we'll do that, and I'm going to zoom in by using the zoom rectangle, my favorite tool here. And I'll probably also change the grayscale here. It looks like it's got upset. I have a standard one I use for breast. Okay, so you can see where we come through the surface here. It's upset just a little bit. So I'm going to use the Pearl tool to edit that. So the Pearl tool, if you start inside the contour that you're editing, you can see the center of that has a plus. That means by default it'll be adding. If you start from the outside, you can see it changes to minus. That means it'll start by subtracting. So I'm just going to paint that out so that the external contour looks correct here. There won't be very much that's wrong. Yeah, and this is not in an area that's really critical. So we're pretty much done with that. The external is done to my satisfaction. So we'll save by hitting Control S. I'm going to reset the view to be the full view again and come back up and get ready to do the applicator itself. I'll zoom in again. This time, of course, we only need to see the applicator itself. It's important that you select a window and level setting that allows you to visualize where the boundary is pretty well. If you use a too narrow a window, which is often what you would do in order to visualize the structure of the anatomy in the breast, you'll get some blooming artifacts because you have overrange in the balloon. So you just need to be aware of that. I've selected my my standard breast 0 and 1,000 here. That allows me to see this probably the best. Now for the applicator itself, I'm going to create that one, and I'll just type in A here, and I get applicator, and I'm ready to go. And I'll use the magic wand tool now to do this one. And I'm going to do the whole volume as a single polygon, and we should set this to accept holes, because if it misses some sections in here, it'll clean that up. So with that set, we just drag it across until it's more or less covering the entire volume. And there we have it. Oh no, I did this wrong. I accepted the holes. Let's do that again. And it'll get rid of the holes. There you go. So we finished that part, and you can see if I scroll up and down now that it has gotten a pretty good outline of the balloon, except for the areas that are low density here. And there's also an area anterior here where there's a bubble inside the balloon. That's a little bit of air inside the balloon, and we'll want to include that as part of this structure as well. And you can see we have a little bit of low density here. So this again is an area where the Pearl tool is quite useful. So we can just click in those areas and clean them up. It's really fast. And we'll go back the other way, get the bubble, the bubble, the bubble, maybe a little bit of bubble there, and then there's some of this low density stuff. Oops, I was inside the low density region. What you can do to alter that is to hold down the Shift key if you do that, and that'll change its behavior to add instead of subtract. Okay, I'll clean that up just a hair, and that looks just about right. Now we'll also want to simplify this structure, and that's right here. And that'll resample it back onto the original images and do a little bit of cleanup and reduce the number of vertices in the contour, which is sometimes useful. Okay, and I'm going to save that as well. Okay, the next structure of interest to us probably is the chest wall proper. Now, there are basically three types of regions of interest that you need to be aware of. The first type is the ones that we use for optimization, and those would be structures that allow us to drive the optimizer when we get to that point, but may not be used for evaluation. There's a second type that's used for evaluation, and these would be anatomic structures that we want to do DVHs on, or the planning structures themselves like the PTV. There's a third type, and the ribs, for instance, or the skin. The third type is used just to create other structures, and that's what we'll be using this chest wall contour for, because what we want to do, we don't generally care what the dose is to the chest wall proper. We do care what the dose to the ribs is, because that's a critical structure and we're concerned about rib fracture, but we don't care too much what's happening to the rest of the chest wall, like the intercostal muscles, and certainly not to the pectoralis major muscle, which you can see here. But what we're going to do in this case is we'll use a structure that we'll call chest wall, and we will do that as a substrate only to build other structures from, because when we create the PTVs, we'll want to do those by margining, and we want them to stop where we exit the breast tissue proper. So in our definition of the chest wall, we're going to include all of the pectoralis major muscle as well. Now, I'm going to make this just a little bit smaller so I can do a little bit more of it, and I'll create this chest wall structure. let's see, I'll create this as an organ maybe, organ, and I'll call it chest wall. Now when I create the chest wall, the easy way to do that is to use the Pearl tool again, and I'll use a little bit larger diameter here. And what I'm going to do is I'm going to drag this to draw the anterior margin, and I'm not going to worry where it comes out on the posterior margin. So I'll just drag it, and we paint with that tool. And you can see perhaps that it stops cleanly at the edge of the window there. So we can set up our windows so that we make it limited to an area that we're interested in. So there is one slice. Now this is a simple structure, and we can draw it on about every third image, and that'll be plenty, and we can have it interpolate later. Now you can see that there's an area down here below the pectoralis major that is in fact breast tissue, but we don't want our PTV to go beyond the pectoralis and pick up tissue beyond that. So that is proper. We're going to do this in a simplified way. Okay, and we'll just keep drawing here. I'll keep drawing and stop talking, just so you can go a little faster here. I'm doing this on about every third slice, and we'll want to do it as far as the balloon extends and a few centimeters beyond that, because some of the structures we're going to create will go a few centimeters beyond the balloon. And since we're only doing it every third slice anyhow, it's not too much work to do that. You can see that we've gotten below the balloon here. I'm going to get that upper part now. Again, it's about every third slice. And when we're done with this, we don't have to explicitly ask it to interpolate. You can see the intermediate contours here are interpolated. We're done with the tool here. When we simplify this, the interpolated contours will be drawn just as if they were regular contours. So I'm going to go ahead and do that, and we'll do the same thing here. It resamples it, and now you can see that the chest wall structure here is drawn on every slice. And generally you'll want to check and make sure that it looks correct on every slice, but it does a very good job there, so it's not too much of an issue. So we've got that structure. Now we don't really need to show that structure anymore, so I'm going to turn its visibility off here in the Case Explorer. The next item is probably the ribs themselves. Let's do that. And I think I have a special type. Yep. And I'll do that in pretty much the same way. I'll use a smaller cursor here. I like about 13 millimeters for ribs for reasons that I'll show you in a sec. And these have to be pretty much drawn on every slice. So the way the Pearl tool works is I will draw it and then come back and erase the part that I don't want. And I'll go just a little bit above where I was there. I'll draw this rib. Now we're only doing the bony ribs here. And you can see that this is pretty fast to draw in this way. Using about a 13 millimeter Pearl works quite well. If you need to draw little tiny bits, you can use the arrow keys on the keyboard to jump back to a 3 millimeter and draw small structures at the same time and then jump back. But there we go. Now if we try to draw a second rib in the same view, we have to hold down the space bar to make it in draw mode, because it'll by default be trying to erase. And then I'll erase the excess for both of these. This one I also need to draw a little more. And the real purpose behind drawing the ribs in is that we'll want to be doing DVH analysis on the ribs later on. And we will probably want to limit the maximum dose to the ribs. And in the old days, we didn't have any parameters for what that ought to be. People are saying these days about 145% to the ribs. And of course, the lower you can get that, the better off you are. And the way we're going to evaluate that in OnCentra is that we're going to use DVH markers, which I'll illustrate a little bit later. and what we'll set is a volume of 0.1 cc. So we're going to look at the minimum dose to the maximum 0.1 cc volume. That'll give us something like a point dose, but it's a little bit more reliable than doing the maximum dose in the volume, because that's subject to drawing errors and so forth. That's a little bit more reliable, like doing a D90 instead of D100 for prostate. The ribs is probably the most tedious of the structures to draw here, because you have to draw it on every slice, and you have to be concerned about whether you need to do these extra ones here. Since we're only going to be looking at the maximum dose, any areas that are getting low dose, if we don't get them drawn, they won't make too much difference anyhow. But since we don't know where the maximum dose is going to be, we are being careful to conservatively draw everything that we see that's in reasonable proximity to the balloon itself. Come on. It's really hard to get good help. There we go, and I'll draw the second one. Did you see how fast and smooth this Pearl tool works? It's one of my favorite tools on OnCentra. It was originally designed for editing contours in the prostate, but I find that it works very well as a painting tool as well, as you see here. This is a lot faster than trying to draw these point to point. There are auto-contouring routines that can get the ribs as well, but they tend to exclude the central portion of the ribs, and they're kind of finicky. So if you can just draw them like this with a fairly slick tool like this, that's my preference. But of course, everybody will have their own preference for how they draw things like the ribs. Pretty individual. Just make sure that you get the areas that are likely to get the highest dose from your implant, so that you can limit the high dose to the ribs. Okay, so let me turn the external off so you can see this now in the 3D view. It looks like we've got pretty much the area that we're interested in, and the chest wall as well, so we're good for that part. Okay, next, we're finished with this. We can go back. If we have our chest wall in, then we can start creating some of our other structures. Oh, I guess we could do the air at this point. Let's. I don't know if I've done that, and I'll put that in as an organ as well. In this particular case, the air is not very interesting. There's just a small amount of air here. But like we did for the balloon, we can probably do this with the magic wand. Like that, and turn that off, and then have a look at it. Looks like it's gotten a fairly decent look at that. And if we look at the volume of that, that's now illustrated in the Case Explorer. It's only 0.2 cc's, and of course we want that to be less than 10% of our ultimate PTV eval, which usually runs about 100 cubic centimeters, or 60 to 100. And so this is likely to be not very interesting in the long run. Okay, so the next structure to create is the PTV. And I create two different PTVs, one to get the surface and another one for evaluation. So I'll create one first for optimization, and we'll do that by margining from the balloon here. So we start by selecting the applicator, and then we'll take the margin tool, and we'll put a 1 centimeter margin on this, like that. And in this case, we want to avoid the chest wall. That's why we've drawn it there. And we also want to avoid the external. And on the external, we'll actually want to put a margin to, let's do that and this. On the external, we also want to put a margin to the skin. Now with the external, I'm going to give myself a margin to the skin of 5 millimeters here. So when I calculate this margin, This takes a few seconds, and it'll be displayed here in all the views as a dotted line. And you can see that it has stopped right here at the chest wall, which is as we would like it. There probably isn't any effect of the external here. There will be on a challenging case, but this case doesn't approach that, so that's not an issue. Now, it's true that that some physicians would have a preference to not limit their PTV for 5 millimeters from the skin. The B39 protocol shows a 5 millimeter limitation primarily because for consistency with external beam where we can't accurately calculate in the buildup region, they're limited from 5 millimeters of the skin for evaluation purposes. Some physicians draw their PTVs 5 millimeters from the skin in all cases, others do not. I would say for this first PTV, which we're using for optimization, I would always limit it to 5 millimeters from the skin. If the physician does not want to do that for his evaluation PTV because of personal preference or because there's a close margin anteriorly, then you can create the PTV for evaluation in a separate operation and use a different margin from the skin. But for this one, I would recommend you always keep it 5 millimeters from the skin. In this case, it doesn't make any difference. So we're going to create a new ROI from that. We create ROIs on the fly in OnCentra, and we will resample it back into the original slices as a new structure. And the type is going to be PTV, but I'm going to change the name here to be PTV for optimization. Okay, and we're done with that now. If I turn the applicator off, you can see that this PTV for optimization is a centimeter margin around the balloon, and it includes the balloon, but it is limited to only breast tissue, and it doesn't approach the skin. So that's the way we want that. And when we do the optimization in IPSA, this is the structure that we'll want to use primarily. Now the PTV for evaluation will be the same structure minus the balloon. So we can do that just by subtracting the balloon. So in this case, we call it applicator here. And we'll apply that subtraction, but now we're going to do this as a new ROI so that we don't overwrite the original one. And I'm going to select PTV again here, but this time we're going to call it PTV eval. It'll be slightly different. And once that's done, the first thing I will do is change its color. I like a dark color for this. And so here you can see the PTV eval. And the differences between the PTV eval and the PTV for optimization is that, of course, the PTV eval does not include the balloon, so it has both an inner and an outer surface. It's a complex structure where the other one is not, and it breaks in places. And on some slices, you may find little islands of PTV eval, not in this case because it's so plain vanilla, but sometimes you'll see little islands here as well. That really doesn't make any difference for this kind of structure. It's fine just the way it is. Okay, there's one more structure that we want to create here, and that is one to allow us to evaluate the dose to the skin. Now, in the B39 protocol, and in all the prior experience actually, the dose to the skin was defined as the maximum dose anywhere at the skin-air interface. So we are not going to create an internal organ inside the skin, as some people have wanted to do. What we want to do is to know what the dose is at the skin surface, so we're consistent with all the prior experience. And the simplest way to do that using dose volume histograms is to create a structure that's margined from the balloon like this, that goes outside the body, that we then crop by removing the body from it. And I'll show you just how to do that. So the first thing we'll do is select the applicator, so that's the current, and then we'll use the margining tool again. This time we're going to set about a 30 millimeter, and we're not going to have any avoidances. And when we calculate that, that's going to take a fair amount of time here because OnCentra uses a marching cubes algorithm here that takes forever on a large margin. There we go. And you can see that it'll go outside the body here. That's exactly what we want. So we'll make a new ROI, and we have a structure name of Skin Max, and that's what I want. And this is what it looks like. And let me turn some of these others off so that they don't confuse you. And the PTV for optimization. And you can see that this one is solid and it goes outside the body. So we have what we want. All we need to do is subtract the body contour from that here. And now we have a new contour. You can see it here. It's outside the body. Let me scroll down and up a bit. And let me make that a little smaller so it's easier to see. So we have this structure. It's outside the body. It's not anatomic, but it's in intimate contact with the external skin surface. So the maximum dose anywhere in this structure will be identical with the maximum dose anywhere in the skin. Because it's a maximum, that's something that's easy for us to pick out with a DVH later on. We'll use DVH markers for that. Also note that the dose we're calculating will be, of course, just outside the skin boundary. And that's going to be a little bit lower than what you would get if you did a point dose right on this boundary, but it is, in fact, consistent with the way you would measure the dose. If you put a TLD or other detector on here, you would actually be measuring a dose inside this volume. So it is, in fact, completely correct. So we've got all the structures we need here. I'm going to save it once more and move on to the brachytherapy planning workspace, the activity. There we go. Okay, now we're going to have to change what our view looks like here a little bit. So let me get that set up. I'm going to take a break. I'll do that offline for a sec. Okay, I've got the window set up the way I like it for reconstruction. I generally give myself 4 panels here. And then I'll select the ECS views because that's the easiest for doing a reconstruction. I'm just going to drag a few of these into my image windows here. And, oh, I see I already have a plan here, so I'm going to stop for a second. Okay, I got rid of the original plan. Now, with these ECS views, they allow us to orient the planes rather rapidly so that we can see what we're doing as best possible. When you have an ECS view, of course, you can select that window and you can move the axes around wherever you want them in the viewing window, and all the other windows will snap to that. So the first step in this usually is to move the origin to the more or less to the center of the applicator in all the views. Once you do that, then you can zoom in on one or another of these, like so. And I'm going to take the properties here in the zoom. I will apply that zoom to all the views. So now we can see in all these views where we are. I can probably zoom in a little bit more. Now the zooming is independent for all of these windows. The other thing I want to do is change my window here, the window level settings, to be a little wider. You can see we have a window width of 500 here. What I normally do is to select my standard breast 1000 here, and I'll apply that to all the windows. Now you can see them probably optimally. Let me make these others just a little bit larger so they fill their respective windows. There we go. Okay, now I'm back, and I'll try to move all of these to the center of the balloon and orient them so that they're along the axis as best possible, and we're just about there. For OnCentra in particular, it's important that when you orient using these windows, you make the positive y-axis, which is right here, be toward the distal end of the balloon. When you do that in OnCentra, you are guaranteed that this transverse view here, which is the ZX view, will be looking from this direction to that direction. So you're looking along the balloon from the loading side, so that the channels will be numbered in clockwise order. A few items to look at here in the views. This is a current version of the Contura balloon, and in this particular balloon, we now have a marker. Let me turn off the ECS views now. I guess it's off. In this, you can see in this cross-sectional view, in this channel right here, there's a faint opacity there. That is a nitinol wire that's embedded just below that channel, and it's part of the balloon. It's there to help you identify which is channel 1, and this is channel 1 in this particular patient. For some planning systems where you can't be certain that your orientation is the way we've set it up here, it's useful to place a marker in one of the other channels. Here they placed a radiographic marker in channel 2. You can see it in this view quite well, and that is just a solid wire that's been placed in channel 2. So once we bring our axes to the center of the balloon and we rotate around so that they cross through the channels, all 5 of these channels will be displayed over their entire length in one view or another. And you can see, say in this lower right one, we can see that nitinol wire here. That means that that's channel 1, and that's this one here, and opposite that is channel 3. In the orthogonal view, we have channel 2, we can see because we have the highlighted marker here, and opposite that will be channel 4. And channel 5 is along the center, and we can reconstruct that in either one of these views. It doesn't make any difference. So we will start inserting our applicators now, and we'll go from there. Now, in this case, we have 5 catheters, so I'm going to enter 5 here. Generally, we want to make a 5mm step and start at the tip end, because this is where we know that everything is. I like to project the current catheter when we're doing that. And for any type of an applicator where you see the end of the channel, and that's what we see here in the end of the balloon here, there's little radiographic markers, and those mark the interior end of the channel. We're going to reconstruct from those rather than from where the first dwell position is. The first dwell position, as you know, because of the source position simulator, is 4mm short of that. So what we want to do is to set an offset for all of these of -4mm. And depending on which version of the software you have, you can either set it here for all of them, or for the newer versions of software, you should be able to set it right here and get all of them. Let me see if I can get all of them and get that to work here. Yeah, in this version of the software, we can get them all from the very beginning. So I'm going to start with catheter number 1 here, and that will be right here in this view. So once I make that one current, I have the reconstruction cursor that you're used to seeing, and I want to do that right at the proximal end of that distal marker there. And what I want to reconstruct is the air column in this channel, which is just over the top of that marker. So I'll start here, and then I'll just select positions along that air column. And what I'm going to do is I'm going to stop inside the balloon, because we're going to use IPSA, which will automatically do the dwell activation, and we don't want it to activate positions outside here that are in the tissue, even though they are in one of our structures. So I've got number 1, so I'm going to go to the next channel here, and I'm going to reconstruct that up here as number 2. So that'll be right here. Now, since this one's actually in the channel, we'll reconstruct right over the top of the bright stripe here. Again, we're going to stop inside the balloon. Number 3 is opposite number 1 here, so we'll just reconstruct that. And you can see that this goes pretty fast. Next is number 4, which is up here. And number 5, which is in the center, and I can reconstruct that on either view here. I'll just reconstruct it on this one. And we're done with all of our catheter reconstruction. And from there, we can go directly to IPSA. Okay, one more thing before we go on to IPSA, and that is that you need to make sure that you get the offset correct for every channel. In this case, it's -4mm because we're measuring from the end of the channel, and that you get the indexer length correct for each one. And you actually need to measure this at the time of simulation, and it might be different for every single channel. And a typical value is about 1257. If it's more than a few millimeters different from that, you need to check very carefully, especially if it's short of that. That could mean that you have a kink at the patient's skin surface, And if you treated to that length, you would, of course, have a misadministration. So all of the values will be close to 1257, but each one needs to be measured, and it's important that you keep the balloon, the shaft of the balloon, as straight as possible when you measure that and when you treat it. Okay, when we start to do the optimization, what I want to see is the DVHs. That'll be most important here. So I'm going to switch over here, and we're going to go back to the reconstructed images. And one of the reconstructed images, the last one here, is the DVH. And since it's so important, I'm going to take the whole left half of the screen here. And it's important with the DVH which items you include in it. So I'm going to go back to its properties. What I want to see in there, of course, is the skin max, the PTV eval, and the ribs. Those are the only structures that we are really interested in terms of evaluation. Of course, for the PTV eval, what we're going to be looking for is that we want to have a V95 greater than 95%. That's much higher than we used to do for the V39. That was V90 at 90%. Also, we'll look at the V100, V150 and V200. In this case, we'll evaluate those directly on the PTV eval, although that's strictly not entirely correct. But in most good cases, that should be very accurate anyhow. We're going to look at keeping the V150 under about 30 cubic centimeters absolute breast tissue, the V200 under 10. And we want to get the skin max, of course, as low as possible. V39 says 145%. The Contura registry says 125%, but I prefer to keep it lower than that when we can. And of course, in this case, it's not going to be very interesting because we're a long way from the skin. It'll be very low. And we'll put the rib dose. We would like to see that below about 140%, something like that. If you can keep it below 125%, you're really good. So when we set up our dose volume histogram here, we're also going to use the table, and this is the DVH markers that are a new part of OnCentra that are very powerful. And we'll select presets that we've already created for that. I've got some that are called Contura already. And once I've got those all in here, make sure I've got them all. The PTV eval is named differently in this one, so I'm going to have to reselect it. And you have to be careful that you always spell these in a consistent way, otherwise you'll have this particular problem. So I've got the V150, the V200, the V95 is our coverage number here, and the ribs and the skin max. So I'm just going to move those down so I get the maximum in here. Okay, so we're ready to go to IPSA. IPSA will do activation and the optimization for us. So we'll pop up IPSA here, and perhaps you can see all of the items in here. Now, we don't want to be optimizing on the PTV eval because we're going to use surfaces as well as volumes, and so the PTV eval will give us erroneous values because there's an inner and outer surface. That's why we use the PTV opt. So I'm going to select that here. There we go, as the reference target. And let me see, I actually have a solution for this already. Do I? Yeah. Okay, I've already got that. Just do that. So sure. I'm going to go through this manually so that we can get this right this one time. We're going to use the PTV opt as our reference target, so I select that. There we go, reference target. And we will set surface objectives here. The minimum surface dose will be equal to our prescription dose, which is 340. The maximum should be about 10% higher. I can select it here, there, 380. And both of those we can leave at about 100% weight. The volume for this we'll set also at 340. And the maximum here we're going to set at about 510. We don't want to set it too high because this is the one that gives us the best control over our the shape of our DVH, and we want that to be at about 150% in pretty much all cases, not just for breast. But this is an adjustable parameter here, and we're going to set its weight down a little bit. I take a default value of about 40 for that one. The other thing that we want to do is to include the applicator as a target. And what that will do is that if we select that as a target here, but we don't set any objectives for it, that means that any points that are generated for the PTV for optimization that actually also fall inside the balloon, because one's inside the other, those points will get reassigned to the applicator, and since the applicator has no objectives, they're essentially discarded. So the PTV opt overlaid with the applicator with no objectives is the same as doing a volume optimization on the PTV eval. The difference is that we can do a surface optimization on the PTV opt, and that'll only be the external surface of the PTV, which is really what we want. Now, we could put one in here for the skin max if we had a high dose to the skin, and that would bias our optimization a bit. That won't be very important in this particular case, so I will leave that unused. And there's a tool up here that you can suppress all of the structures shown except for the ones you're actually using. That makes it just a little bit easier to see here. So we're going to go ahead and run our first pass of IPSA here. Now what it's doing is that it generates all of its dose points, and then it does 100,000 iterations of the simulated annealing, and it gives us a distribution that we can look at. I'm going to put IPSA away here so that we can see what we're doing. You can see here the V95. I'd like to have that at just 95%, and we've gotten a little bit more than that, so I've coded it pink to be just a little bit more than what I would like it to be. I'd like to have that just about at 95%. The hot spots here, the PTV, the V150 here and the V200 here, remember we said we want this below 30, which we've achieved, and we want this below 10, which we've also achieved, so they're within the range, but they're probably higher than they need to be. And if we're trading off coverage here versus these we have absolute maximum for, but we know that we want them as low as possible. So if we can give up a little bit of this to come back to about 95%, we can make these even lower so that the homogeneity within the volume is a little bit better, and we're over-treating less breast. In this particular case, the maximum skin dose, I've color-coded these as a bright blue, meaning that they're way below what we expect for them to be. So the maximum to the skin here is only 65%, and to the rib is only 68%. So that's not going to play any role at all in our optimization. You can see down here where we've created dwell positions in these catheters. And you can see them in these two views as well. In catheter number 1 here, pretty much along its length, excluding the ends, we've activated dwell positions. In number 2, we've done quite a few. Number 3, just a few. Number 4, only at one end. So that's a typical sort of scenario for this. Let me turn the PTV eval on so you can visualize that a little bit better. The other thing we want to see here is the red isodose line here, which is our 100%. We want that to be covering our volume just very conformally. And you can see we've done a fairly decent job there and here. Of course, in the area of the chest wall where we might be willing for it to go a little bit lower, it's a little high, but that's fairly typical. We only have so much modulation to play with there. But also pay attention to the 150 and 200% isodose lines here, and we'll see how much volume we really have there. We've already calculated it from the DVH directly, but this will tell us where we're making those compromises. And this is typical. If we're modulating in the area along the side of the balloon to reduce the dose, we will get a little excess dose along the ends in order for our volume parameters to come back where we need them to be. Okay, so the status after one simple pass here is that this is probably an acceptable plan, but we could probably reduce our coverage here a little bit in order to reduce these even more. So I'm going to go back to IPSA, and the value that we would play with typically would be the weight of this maximum dose here. And you can see that, and you got to be careful about how you drop the thing here. I want to move this over here, but not let it dock. Here we go. This 40 weight is probably a little high, and so what we want to do is no, it's a little low, because what we want to do is reduce our coverage here to make these better. So we want more homogeneity, so we will increase the weight of our homogeneity objective here. So I'll take this one, and I will increase its value. When you start playing with these values, there we go, I would make large changes in them, and then once you see what the effect is, then you can make smaller changes as you get close. So we'll re-optimize that. And when we do that, as soon as IPSA finishes, the dose volume histogram will be automatically recalculated and updated, and you can see that we've achieved the result we want here. We have just over 95% here in our coverage, and we have reduced the volumes of the hotspots here as low as we can reasonably get them, and these are really quite acceptable values. And in this particular case, we're not interested at all in these because they're so low. So this case is essentially complete. We've done the best we can with the parameters we have. It's time to then show this to the radiation oncologist and make a final determination whether this is, in fact, the treatment that they wish to deliver. So we're going to stop right here on this case, and we'll pick up again with the more challenging case where we have some real questions about the skin and the rib doses.